Hey there, I'm Jane Hernandez, and I'm a licensed mental health counselor here at the Behavioral Health Center at TMH, and I'm here to start a conversation about violence in our community and nationwide, and I want to provide some feedback and some guidance to parents and kids that are struggling with these difficult conversations. Rather than offering all of the information that you as an adult have been exposed, I think kind of asking them about what is going on in their school or something that they did at school, especially because obviously teachers and school administrators are going to be implementing strategies and implementing drills and things like that. So like checking in with your kid about like, hey, how's it going in your school? Using open-ended questions such as, what was the hardest thing about your school day today, instead of how was your day? Providing an angle for kids to be able to kind of just go in a little bit deeper, to have those conversations with you as well. Talk to your kids about this in the most open, non-judgmental, and compassionate and patient way, because they have questions. And most kids, if we're talking elementary age, middle school, and even high schoolers, they don't really have words to, or they don't really know of how to express what they're feeling because they may not know how they're feeling. So having, the chance, or giving them the chance to kind of express how they're feeling in ways that are creative, such as drawing, listening to music, or even just talking about like, hey, like what's going on at your school, or what are some of the things that you learned about what's going on at school. Just those, having those open, non-judgmental, compassionate, and very patient conversations. One of the things that I recommend is for parents to limit social media exposure, just because I know that a lot of kids talk and a lot of kids have access to social media, whether it's the social media apps, YouTube, or even the news, and kids talk. Right? So limiting their exposure, and also for adults, limiting your exposure to the news. I'm not saying avoid all news channels, but I think limiting your exposure to, kind of give yourself time to process what's going on, because our brain doesn't really have a go-to way of processing information. It kind of processes how it processes naturally, and sometimes it takes a little while, and sometimes it's a little bit more rough. So giving yourself time to kind of decompress and process the information that you're receiving, would be really important for you to kind of be open and comfortable when you're having these conversations with your kids as well. I think that one way to kind of monitor that would be to just ask them, like, how are you feeling? And there's no right or wrong way to feel about what is going on. So asking them how are they feeling, and if they are feeling some feeling like anxiety, worry, sadness, powerless, helplessness, it would be to kind of just normalize that, and then also validate that, right? I totally get that you're feeling this way. Can you tell me more about that? Or even offer, once you're having that conversation and you're validating how they're feeling, what would you like to do about this? Do you want to go on a walk? Do you want to practice some mindfulness? Do you want to write about it? Do you want to listen to music about it? And kind of offer different ways that they can cope with that feeling. In addition to that, I think it would be really awesome and really productive to kind of just, again, reiterate and kind of remind them that there is no right or wrong way to feel about this, that it is very confusing for a lot of people. And so to, again, normalizing that and kind of letting them know it's okay that you feel the way that you feel, even if there aren't any words to describe that. And then also, continuing to encourage, and this is something that I encourage to a lot of parents of any school age child, is to encourage them to have a safe person. Now that they're not in school, they're not going to be exposed to a lot of safe people, right? Because they're not going to have the social workers, the school guidance counselors, the teachers, their friends maybe, and other safe adults. So encourage them to have a safe adult. That could be a therapist, that could be a summer camp counselor, it could be you as the parent, it could be someone that isn't just another school-aged kid or child. It could be another adult that they would feel comfortable in having these types of conversations. I guess I'm a little biased because I am a therapist, but there is, things don't have to go awful in your life for you to go seek therapy. Therapy could be a maintenance type of thing. It could also be a tool for you to be planting seeds for the future. It could be a tool to just be able to figure out how you feel. A lot of the times, we don't realize that a lot of kids communicate through behavior, right? So if they're having more emotional tantrums than usual, if they are isolating, if they are more anxious, if they're doing more sneaky things, right? If they are hiding things, if they are, they don't want to talk to their friends and they don't want to talk to adults, if they're kind of isolating or withdrawing, if they don't want to spend time in nature, if they don't want to do things outside, if they just seem down and withdrawn, or if they seem tense and irritable all the time. These are all signs that indicate that something might be going on, not necessarily something that is wrong, but something that maybe they can't handle because they don't know how to. And this would be the time for you to kind of step in and be checking in with them and kind of just ask them questions. And sometimes it's okay, especially with maybe the middle schoolers and the high schoolers, it would be okay to just be like, hey, do you want to talk to a professional about this? Maybe I don't have all the tools. Or do you want to go to family therapy together so that we can kind of learn how to navigate these difficult things that you're going through? I'm going through difficult things too, and it would be nice for us to learn how to handle these things. Doing those types of things. And even little kids enjoy talking to other adults about what they're going through, especially if you're coming from an approach of non-judgment and very open about, like, hey, there are people that are trained to help kids learn how they feel and learn what to do about their big feelings. I think those would be kind of things to look out for. We do spend a lot of time talking about the feeling part of it. A lot of people, children specifically, young children, older children, have a hard time sort of taking time and taking space to really process what that feeling is like. So we spend a lot of time really like, okay, what does that feel like? Where are you feeling that in your body? Like, what does that look like? If that worry had something to say, what would it say? And we spend a lot of time kind of really processing those feelings so that they kind of make their way out of their body and make their way out of their brain so that they do have, a place to kind of process that. In addition to that, we talk a lot about coping skills. We talk about creative ways to utilize coping skills, right? So there isn't, you don't have to journal about your feelings to be able to process them outside of therapy. You can do a lot of things. You can maintain active lifestyles, right? You can talk to other people about how you're feeling. You can listen to music. You can write music. You can make a yummy recipe. You can do a lot of things that would be able to kind of, number one, distract you from that feeling, but then also kind of give you time to really just find some comfort in other feelings as well. Because I remind all of my clients all the time, my patients all the time, that feelings are temporary, that they don't have to stay with you the whole day. It could just be, this feeling, this discomfort that you're feeling, and then, you let it do what it needs to do, and then you kind of move on. Basically, every feedback and suggestions and strategies that I teach my kids, I teach their parents because I think it's important. You cannot pour from an empty glass, right? And you need to be ready, right? And in order for you to be able to practice patience and compassion for your kid, you have to be able to do that for yourself. So kind of, again, normalize and validate that it's totally okay. Name the feeling. I feel really scared right now because I don't know what to tell my child about what is going on. Normalize, validate that, and then come up with a plan. Ask for help. There are a lot of resources that are available for parents, for caregivers, that could help you sort of navigate what it's like and how do these symptoms kind of show up in kids if they are having a lot of anxiety or a lot of, you know, um, depressive symptoms because of what they have been exposed to, because that is normal. So again, kind of practice a lot of self-care and a lot of checking in with yourself, and don't have these conversations, these deep conversations, when you are very frustrated because they forgot to do the dishes or something, or they forgot to do a chore. These are supposed to be conversations that are going to strengthen your relationship with your child, and they're going to also teach you about your child and teach you about how they process emotions. Also, another thing to consider is that a lot of parents model, consciously and subconsciously behaviors for their kids. So being aware of how you are handling your emotions and what you're saying, and lead by example, and to be able to kind of, again, normalize, validate, and just be really kind to yourself, because these are really hard times, not just for kids, but for everyone that is here, understanding of the gravity or being exposed to these situations. You can't control everything, right? So being realistic about that is very important. But I think, taking on a more involved approach in your child's life can definitely, if not prevent some things from escalating, it can definitely be a strengthening tool to be able to emotionally understand your child, right? And so understand, like, what are they doing, right? What are they doing in their spare time? Who are their friends? Being involved in situations where parents need to be involved, where adults need to be involved. I always talk to my teenage patients, and I tell them, I love that you have so many friends that you can trust and that you can, communicate with, and that you feel safe with, but we also need adults in your life that you can feel safe with to talk about these things, because sometimes feelings do feel really big, and other kids and other children can't really help you on how to handle those feelings. And so kind of really being very involved, and what that looks like is, again, asking open-ended questions. It looks like monitoring their social media. It looks like, tell me about your friends. It looks like, what's going on at school? What does your typical day at school looks like? It looks like having these very check-in conversations with your children every day, if you can, to get to know them a little bit better and get to know what they're doing, what they're liking. And then also spend quality time with them. I think it's important that you get to know them as they grow, because they change, they evolve, they explore their identity, and it's important to be involved with them through that process, because it is very confusing. But I think, again, a lot of parental involvement is necessary. And then also, if you are into social media as a parent, following the school's social media pages, following, whether it's on Facebook, on Instagram, whatever it is, following these social media pages that are dedicated for safety, that are dedicated, for mental health resources, that are dedicated for academic resources, and just being really involved in that aspect as well kind of gets you in the know, and it gives you a lot of substance to have these conversations with your kids. I'm not really sure that it's possible to be in a clear state of mind all the time, but have these conversations when you can take this information, right? And so that you are able to make these decisions about, okay, is my child struggling to the point that they need help that I cannot provide? Do they need therapy? Do they need, to have a visit with a psychologist or a psychiatrist to get evaluated and kind of see what is going on? During school time, you can always utilize the resources that the schools have, which they have social workers, they have guidance counselors, they have teachers, they have administrators whose job is to help your child thrive in the school setting, but also in other settings as well, right? And so as the parent, being able to kind of just, again, gauge where it is where you feel like maybe you cannot handle, something that is going on with your child, that could be, helpful to maybe seek professional help, right? And this could be from, a child being so anxious that they can't get out of their bed, or they can't get out of their home, right? Or this could be, depression, or it could be even, any other signs that something else is going on, that they're having trouble adjusting to a big life event that has just occurred, right? And so understanding, what your level of what you can handle is, and then, kind of asking yourself, okay, there's nothing wrong with asking for professional help or for additional help, maybe starting with the schools and then hearing what their recommendations are, or maybe just, you know, calling your insurance. And if you don't have insurance, calling community places in Tallahassee or any other area, neighboring area, where these counseling services or children's services are available at no cost or at a sliding scale or something like that.